What about children with anterior open bites? What's the first thing that comes to mind to you? If you had a child or a grandchild or a nephew or a niece, a relative or a friend whose 10-year-old had an anterior open bite, what's the first thing that runs through your head?
So a 10-year-old should not have an open bite.
Right.
So there's something either in the way or that the mandible hasn't grown. So something in the way would be a tongue, but or the mandible didn't grow. So I'd have to start, imaging would be my place to start.
Imaging with a CT and an MRI.
Correct. And
Right.
a lot of times what we're finding is, CTs or cone beam CTs are so easy to get.
Yeah.
You have one in your office, I have one in mine.
It's almost mainstream nowadays.
So it's so easy to get instant information.
Yep.
8.9 seconds later, I have a quality study that I can start making some determinations.
And
So-
to be clear, the CT lets us put numbers to things, not like a normal X-ray. Normal X-rays are relatively distorted.
Right.
Yeah, so that needs to be made very, very clear. When you can put a number to something and reproduce it, that by definition is a fact. When you can't, that's kind of an opinion.
Right.
So the normal 2D X-rays that dentists normally take, we can't quantify that. We can just get a
We
glimpse.
extrapolate. We're doing a
Yes.
lot of extrapolation, and we're guessing.
Yep.
So I think, in this...
With a CT, we're not guessing.
Exactly.
It's
So,
to scale.
and that's what's, so exciting. So when cone beams came popular,
Yeah.
my implant surgery, I went back and looked at those, and I'm like, that implant looked great, or my sinus
On
lift
2D.
looked great. But when I really look at it, it's not the same. So being able to have imaging immediately now allows you to really impact on your treatment
And that's the
effectively.
first step. So if our 10-year-old relative or friend sits there with an anterior open bite, first thing I'd want to do to be prudent and objective is snap a CBCT.
Because
A minute later, I'm looking at data that's objective,
exactly.
and I'm able to look at spacing because I can't really see the soft tissue, the cartilage. But from there, I can extrapolate and say, I need to order an MRI if
Correct.
necessary.
Correct.
So I tell mom and dad, hey, we need to look at the disc after I explain to them why that's relevant.
Right.
And it's relevant because if you displace the disc, you change the bite. And oftentimes that will cause an anterior open bite. Normal oral surgeons will try to break jaws, and orthodontists will try to recouple the teeth with braces. And oftentimes things will break apart yet again. That's called a relapse in their world.
Right.
The reality is we both know that that's something originating from the hinge that no one ever looked at. And that is a travesty.
Yeah.
Yep.
And even if it's not an anterior open bite, even if they're retrognathic,
Yep.
have an asymmetry,
Yep.
they still, it's...
Pulled back chins,
Yeah.
something's off to one side, things don't quite look right.
So there's, those are not naturally occurring events.
No.
That's usually a sign of pathology. So with anything else, if we have a blood work and there's an abnormal finding, we're going to explore
it out.
that. So this is when we see clinically there's something that looks askew to what we would
Sure.
normally see. I think we feel we need to be compelled to figure out why.
And in my opinion, as a general dentist, I think that needs to happen even with general dentists.
Right.
Because actually we see most of the people.
You're going to see all the patients.
Yeah,
So,
we're
so
the
you're in the
ones-
trenches because you
Right.
see them first.
Yeah, so the whole point of the CNO, the teaching organization that we're trying to build, is to spread that kind of a word around.
Right.
From the general dentist all the way up to the oral surgeon.
Right.
So I want to see more people like you in my neck of the woods. There presently are none.
Right.
And I'm in the middle of America, and I'm not in some podunk town. I'm in a fairly large metroplex. And I order more TMJ MRIs than all 300 dental professionals, including the oral surgeons, in this area.
Exactly. So
One person, that's ridiculous. It's ludicrous.
So, and just understanding, how important it is.
Yeah, it's
So, the other thing that's the adage that you only know you only see what you know.
know.
So if you don't really identify, if you don't know to look for it, you won't expand on it. So I think our role probably is dispersing the information that if you see this, and this, and asymmetry, a kid that's growing off to one side, they're retrognathic,
Their chin's pulling back.
they don't couple their front teeth.
How about their neck Their posture is forwards, forward neck posture.
So just saying that, that's nothing. No, that is
That's
something. And that's the little clue to say, okay, maybe I might not be the one that does the workup,
Sure.
but that might be worth a referral because...
To the person that does know to image the joints.
Exactly.
And how important the hinges are themselves.
Exactly.
Right?
So we, getting tooled up and getting the experience and knowledge to be able to manage them, it's difficult. But, identifying it first and then being involved in their care.
Yeah.
So if someone refers to me, I'm all about making sure that we're reviewing the scans together. Here's my report. Let's talk about the patient so that next time you see a patient like that, you'll know what to do.
Yeah.
And I think that's on a micro level, it's a great way to start. Social media and things like that is how we get it out to a larger area.
I can tell you, I'm 26 years into practice, and probably the biggest hallelujah that I've had in those entire 26 years. And I'm always keeping up with the times. I'm pretty high tech. Got most of the gadgets. The realization that I have to image the joints is probably the most profound thing that I've ever run across in my entire career.
Yeah.
And so I'm trying to make it a mission for the last 10 or 15 years of my career to spread that around, because I realize I can help more people that way.
Absolutely.
And I don't want to keep it close to my chest or just in my community.
Or a secret.
Yeah,
Yeah,
right.
exactly.
There's some of us that know it, but we need to spread it out there.
So how about look at it as from a public health standpoint?
Big time.
So where you really want to impact the masses.
Yeah.
And
You and I have been around a while, so it's not like we're like in the prime of our careers. We've already made a decent living. It's not about money. It's about passing it on because we give a damn.
Right.
It's real simple. Yeah. So I don't know what to tell you. What do you think of the CNO initiative? You think we'll get there?
I think it's an amazing start.
Yeah.
But the reality is, so utilizing all of our tools that are available,
Yeah.
and you're a master at that. So I
social
think,
media. I don't know about a master, but we're gonna push it out.
right.
You make the patient demand it, that forces the doctor to provide it, or the patient moves on.
Exactly.
It's pretty simple, supply and demand.
That's it.
Yeah, I love it.
Yeah. Thank you.
Measured matters.
Thank you.
All right.